Hi all, welcome to Inspired Surgeon Ever Wonder series. Disclaimer: this video is created for educational purposes. This video is not a substitute for standard textbooks. This video is created in order to train young minds. Some of the images are taken from online resources. Today we are going to learn about a recurrent laryngeal nerve. What is the joy in making this video and learning from this video? Shall we explore? Anatomy and course. Right recurrent laryngeal nerve originates from the right vagus nerve as it passes posterior to the right root of the right lung. It loops under the right subclavian artery before ascending. Left recurrent laryngeal nerve originates from the left vagus nerve as it passes under the arc of aorta. It passes posteriorly under the aortic arc and ligamentum arteriosum. The recurrent laryngeal nerve is named recurrent because it initially travels downwards with the vagus nerve and then loops back up in the neck, seemingly running back to reach the larynx. This contrasts with the vagus nerve's descent towards the chest. Hence the nerve is recurrent designation. The Latin root recur means to run back, further highlighting the nerve's initial path. What is the joy in learning the recurrent laryngeal nerve? Ever you ask yourself why it winds around the ligamentum arteriosum on the left side and right subclavian artery on the right side? Why it has to reach larynx? Some of you may know. If so, then it would be a recap. Let's look into the explanation. Why it winds around the ligamentum arteriosum on the left side and right subclavian artery on the right side? Look at this image. The pharyngeal arches, the dorsal and ventral aorta. Is there any relationship between them? Yes. Embryological development. The pharyngeal arch origin, both the recurrent laryngeal nerve and the aorta originate from the pharyngeal arches during embryonic development. Aortic arches. The aortic arches are temporary structures that contribute to the formation of the mature aorta and its branches. The fourth aortic arc typically form the arc of aorta on the left and contribute to the right subclavian artery. The sixth aortic arc form the pulmonary artery and the ductus arteriosus, which later becomes the ligamentum arteriosum. Look at this image. As we discussed previously, the important thing, the fourth aortic arc, which is highlighted in purple color. Look at the image B, which gives rise to the subclavian artery on the right side and the arc of aorta. Same sixth aortic arc, which is highlighted in the light blue color, which is here ligamentum arteriosum, ductus arteriosus. Now look at the nerve trajectory. The recurrent laryngeal nerve, a branch of vagus nerve associated with the sixth pharyngeal arch. Keep this in mind. As the heart descends in the developing embryo, the nerves loop around the sixth aortic arc on both sides. Right side. On the right side, the dorsal segment of the sixth aortic arc regresses, leading the right recurrent laryngeal nerve to elevate and loop under the right subclavian artery. Left side. On the left side, the dorsal segment of the sixth aortic arc persists and develops into the ductus arteriosus, and this causes the left recurrent laryngeal nerve to remain inferior to the aortic arc, close to the ligamentum arteriosum. Now, why it has to reach larynx? The explanation is here. The vagus nerve, cranial nerve 10, is derived from the fourth and sixth pharyngeal arches. The superior laryngeal branch, which innervates the laryngeal muscles arising from the fourth arch, The recurrent laryngeal nerve, also a branch of vagus, originates from the 6th pharyngeal arch. Here is a more detailed breakdown. 4th pharyngeal arch. This arch contributes to the development of structures like laryngeal cartilage, thyroid, corniculate, and cuneiform, as well as the cricothyroides muscle and certain muscles of the soft palate. The superior laryngeal branch of the vagus nerve innervates these structures. 6th pharyngeal arch. The recurrent laryngeal nerve, which derive from the 6th pharyngeal arch, which innervates the laryngeal muscles. Look at this image. From the 4th pharyngeal arch, vagus nerve derives. The recurrent laryngeal nerve, which is a branch of vagus nerve arising from the 6th pharyngeal arches, which dates back to the embryology. The 4th pharyngeal arch contributes to the development of muscles involved in swallowing, palatal muscles and pharyngeal constrictors, and speaking, cricothyroid muscle, which tenses vocal cords. 6th pharyngeal arch forms the intrinsic muscles of the larynx, responsible for speech, which are innervated by the recurrent laryngeal nerve, and this is why it has to reach the larynx and supply the laryngeal muscles. Ever you wondered about learning about the recurrent laryngeal nerve course and its trajectory? Subscribe at Inspired Surgeon. Thank you.